afternoon, Mr. Allen. My name is Candy Berdan. It is my pleasure to meet you, and thank you for giving me this opportunity to discuss a very important healthcare issue that affects the women of the United States and also healthcare professionals such as nurses.
Thank you. Please proceed.
Thank you, Mr. Allen. I'm a registered nurse for 17 years. Most of those years, I was a maternity nurse. As a member of maternity nurses, I would like to give you in detail what we do. Maternity nurses give care to expectant mothers before, during, and after delivery of their newborn, give compassionate care and support not just to the patient, but also to the whole family, ally their fears as first-time parents about labor and birthing experience, support and respect their decisions about healthcare preferences, teach mothers and families about newborn care, and promote the importance of vaccinations and benefits of breastfeeding. This is where foundation of the children's health is emphasized. However, I did not come here today to tell you how the 12-hour shift of maternity nurses go by. I am here to tell you about the flip side of being a maternity nurse, the not so happy events in the maternity birthing suite or any acute hospital setting. Events when a woman of the United States had to go through when a decision is made about abortion or terminating their pregnancy due to multitude varying reasons. As a maternity nurse, I see a big gap of care provided to the women who undergo this procedure. I believe that with the passing of the Senate Bill S-240 in New York just early this year, this issue I'm about to present will be very prevalent in the upcoming year.
Abortion. Yes, this is an issue regarding women's choice and the right to a fetus to life.
Yes, abortion. Abortion that affects solely the women of this great country, women who constitute 50.8% of the United States population, women who are from the different walks of life, religion, culture, and economic status.
Indeed, Congressman Browley supports pro-choice. However, this topic has been circulating in our society for decades, always part of political debates. Medicine, politics, and members of our society cannot see eye to eye about this issue. I want to hear what you would bring forth about this issue.
True. Not everyone supports the idea of abortion and sees it as against their moral conduct and personal integrity. This is also true in my nursing profession. It creates conflict of conscience for some nursing individuals. The Associations of Women Health, Obstetric, and Neonatal Nursing, a nursing professional organization that inspires, gives support to the nurses in obstetric arena that most maternity nurses belong to, including myself, support that nurses must be accommodated of their religious beliefs and practices. These includes beliefs regarding abortion. As a culturally sensitive nurse and individual, I respect my peers' further decision regarding this matter. I'm not here to debate about our personal choices. However, further research and conduction of interviews among local hospitals here in Los Angeles County, I find that the contacted hospitals do not have a policy concerning employees' conscience objection and workflows about abortion care.
Okay, what is your proposal for this matter, Ms. Berdan?
Mr. Allen, I'm not just a woman, a nurse, but I'm also a big supporter of Access Women's Health Justice, a nonprofit organization. This nonprofit organization supports women's decision to sexual reproductive health and creates the ability of the women in California to claim health, justice, and dignity. Access provides helpline to women that includes referrals and counseling. Women are connected to proper provider for services such as birth control, pregnancy, prenatal, and obstetrical care, and abortion. Access guarantees that women can acquire reliable and dependable abortion services without discrimination or holdup. Indeed, a great program for women and their rights. The program supporters are expanding and penetrate healthcare professionals such as doctors and nurses who believe in the issue. Few issues that healthcare professionals have presented to the table are poor resources, training, policies and procedure in a hospital setting that would support the woman and the doctor's decision. I would like to tell you a story of Mrs. Smith, a case that many women had gone through solely because of their decision. Cases that merely caused delay in procedure and emotional harm to our women, especially in a very sensitive matter. Mrs. Smith and her husband had been trying to conceive for 18 months. They wanted to have another child that would add to their small family of 3. They wanted to have Josh, their 5-year-old son, a baby, brother, or sister. During Mrs. Smith's recent visit to her obstetrician, the couple received news that Mrs. Smith is pregnant. Instead of jumping for joy, the news gave the couple distress and worry. Both were in tears after hearing that she's pregnant with twins. Apparently, they were not expecting twin pregnancy. They cannot afford to care for 2 infants and a 5-year-old. They were concerned of the risk of preterm birth that may possibly add to the financial difficulties and concerned of the risk of preterm birth that may possibly add up to the financial difficulties and caregiver hardships. 3 weeks later, approximately 13 weeks of pregnancy, Mr. and Mrs. Smith decided to terminate the pregnancy and seek confirmation from the obstetrician's office about abortion services. Mrs. Smith was referred to another provider who can perform her request. Unfortunately, she was referred back to her obstetrician because she was deemed as high risk. To provide her the treatment she sought, a doctor agreed to perform a dilatation and evacuation procedure. On the scheduled date of surgery, the procedure time of 9 o'clock was pushed back due to the operating room activities, but mostly to nursing staff, including the operation room team's refusal to participate. Mrs. Smith undergone the dilatation and evacuation not until 7 p.m. Indeed, a 10-hour delay from the schedule. She was discharged home after recovery from post-anesthesia care unit. However, just imagine the emotional turmoil of Mrs. Smith had to go through for 10 hours while laying on a gurney in a pre-op holding area. To fully promote the patient's self-autonomy of declaring her rights to choose, not to cause harm, and to do the right thing for a woman while cultivating the healthcare professional's integrity, hospitals must be prepared in such situations.
So, what are your recommendations on the matter then?
Access would like to expand their services with the help of the subject matter experts such as doctors and nurses and healthcare professionals by assisting local hospitals on how to support the women of Los Angeles County on the matters of abortion. Access would like to develop a program that will be called Empower Nurses, Empower Women. The program will be offered to assist the hospitals in creating policy and procedure that covers on how their nurses can claim their objections to the matter and how they can be supported. Assist the hospital on the provision of care to women and withdraw only if conflict of conscience arises when nursing care is available. Assist in collaboration of hospitals and medical offices to create a workflow when woman decides for the procedure and doctor agrees to perform the procedure. And lastly, assist the hospital in promoting annual and ongoing training and educational programs on how to give care and emotional support to the patient undergoing abortion. The aim here is to help the hospitals to be equipped with resources and prevent cases such as Mrs. Smith. Access would like to gain support of your office through funding to develop such program that can aid local hospitals and clinics to ensure and preserve self-autonomy of women, to prevent emotional harm, to do the right thing by equipping the hospitals with resources. Please take this one-pager information and my business cards for your review.
Well, very well. This will be presented to Congressman Julia Brownlee. You have given insights on how this program can support women and nurses of their rights regarding abortion.
Thank you, Mr. Allen, for your time that you have provided me and be a voice to represent the women, the nurses, and Access.
You're welcome.
Thank you.